go around. Dulce, how are you?
I'm good. I'm sitting in my new office. I just moved in this week, so I'm excited.
Well, you need to tell everybody what you're doing.
So I am now at Wichita State University at their Public Policy Management Center. I serve as the Research and Program Evaluation Manager.
Congratulations.
Thank you.
Yeah.
Congratulations.
Christina?
Hi, everyone. Just summer. I love summer.
Me
It's
too.
great. Yeah,
Me
it's my
too.
season. So yeah, just staying busy. And, it's 104 or whatever today. So it'll be lovely with the wind and everything, but it's all right out here in Dodge City. But yeah, good. Doing good.
We went from freezing cold over Memorial Weekend to blazing hot. I don't
Yeah.
know what we've done to deserve this, but
It's Kansas. That's what I just say. It's Kansas. That's
it's
how it is.
like the worst of Kansas.
Monday's supposed to be like 70 something,
I'm ready.
Yes.
and then it goes back to.
Yeah.
Enjoy.
Mike?
Hello. Summer semester, teaching, still at home for the most part, so not much to report on my end.
Okay. Jackie?
Yeah, doing good. Kids are out of school for the summer, which feels like they were out of school most of the year. So quick school year, but trying to do some work at home and also keep kids occupied. So yeah,
Nothing like doing two jobs at once.
at least two.
Sana, can you hear us?
Yes, I can. Can you hear me?
Yes.
Okay. I don't know why I'm trying to figure out my camera because it's being funny. I'm doing good. I worked in a school, so we are in summer now, which is nice because it was a weird school year with middle schoolers. So I am enjoying the summer. I think the last time, if I can get it, I think the last time I did this, I had 3 or 4 month old. Now we have almost 1-year-old. So I call her my pandemic baby. She's been pretty much just hiding in the house. And now we're finally getting to go out, which is nice. So we're just kind of enjoying the summer. I just wish it wasn't so hot.
That's for sure. Hopefully it'll moderate soon, right?
Yeah.
Okay. All right. Well, we can go ahead and get started. So Justin Spies sent me an email. Oh gosh, it's been at least 2-3 weeks ago saying that he needed to resign effective immediately. So I know we all enjoyed Justin on the committee and we wish him well. And Kendall has been with this advisory committee since its inception, right, Kendall?
Yeah.
Before.
Yeah.
Or,
He was part of the reg committee.
oh, you were? I don't think I was.
Maybe not.
I was working for the state till shortly before I got the call while I was, in between employment to serve. So I was just glad anybody wanted me for anything at that point.
I really relied on you. You had a lot of history. I knew nothing.
Yes, Leslie and I go way back. Well, Kendall, thank you so much for everything that you've done and contributed to this committee and all your hard work. You've just attended, really regularly and helped us out in so many ways with all the educator stuff. And so I wish you nothing but the best. And
Well, thank you. I enjoyed my time on this, but yeah, really did enjoy it.
awesome. Well, if you just become a board member, see, you can just continue on perpetuity like I have.
Maybe someday.
Well, and Kendall, on behalf of the board, we wanted to say thank you too for all of your years of service. And so we put together a certificate for you just to kind of show our appreciation.
Wow.
on behalf of the agency. And so,
Well, thank you.
but yeah, I really appreciate all your
Awesome.
contributions.
Well, thank you very much.
So do you have a favorite memory, a funny memory, a gee, that person really irritated me memory? You know, not on the committee, of course, but
Let's see. Favorite memory. Yeah, I think one, it was not a funny one. I'll have to think if there's a funny one, but was when we set up and did the virtual meeting for the full board to show that how technology had changed and that kind of thing when we're trying to, working toward being able to provide supervision and those types of things back then.
yeah,
And how big of impact that actually had on many of the board members.
that's a really good one because that issue was kind of dead on arrival until we did that presentation, I think. So that was really pivotal.
Yeah, so I think that's maybe one of my favorites.
No, thank you for bringing that up. Yeah.
So, but yeah, I think they've all been good. People have had, just amazing since 2010, the last 11 years, how different the addiction profession looks now than it did
Yeah.
in, beginning of 2010.
Yeah. Well, that's for sure. Okay. Well, thank you.
I think they're having a party next
Oh.
door.
All
Well-
right. So, go ahead.
Deb, before we consider the minutes, there were a couple of items in terms of the kind of opening script has changed now that the
Oh, I
emergency.
forgot about that. I'm sorry.
That's okay. There just might be a couple comments that might be helpful if people are watching this live or over the conference call. So you want me to go ahead and take care of some of those matters?
Sure. Do you want me to start, or you consider me already have started?
I think you've already started and done through the
Okay.
roll call. I think I'll
Yep.
just make comments on here. Okay.
Yes.
This is Dave Fye, Executive Director for the Behavioral Sciences Regulatory Board. And regarding public comment, it allows the public to address the advisory committee. But the Kansas Open Meeting Act does not require the advisory committee to provide public comment. Individuals could provide public comment by sending an email to me at david.fye@ks.gov in advance of the meeting. But no individuals did so there's no public comment at this meeting. But because we're conducting the meeting remotely by conference call and other teleconference ability, I'll state for the record the following information. The meeting is being conducted remotely. However, access to the meeting is being conducted by a medium of electronic communication that allows the members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. And while the meeting is being conducted remotely, the requirements of COMA are not suspended, and as such, we'll be conducting this meeting pursuant to the COMA. On March 12th, 2021, we sent notice of this advisory committee meeting to all individuals who had requested notice of the meeting. And the notice was also posted on the board's website at ksbsrb.ks.gov. And you can obtain a copy of the notice at that website. An agenda and other meeting materials was posted to the board's website on the day of the meeting. And you may request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. And notice contains information for the conference call and the YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240. And a recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting. And you can access that by using the link to the meeting on the agenda.
Great. Thank you. All right, so we'll begin discussion of our first item, which is really the fourth item, which would be approval of the March minutes. Hopefully you all received those.
Okay, thank you. Okay.
Does anybody have any changes to the minutes?
No, I, like I did that month, move to approve them as presented.
I second that.
All in favor, say aye.
I
Aye.
Any opposed?
I'm sorry, who seconded the motion?
Jackie did.
Okay, thank you.
Okay, executive director update.
Okay. Well, I wanted to talk about a few different issues for the advisory committee. One, as you notice, the introductory script is different than how we've been doing things for the last several months. And that is because on June 15th, the state of emergency did end. And as such, there's a few things that are a little bit different. One item that was a little bit different is during the pandemic, there have been declarations of emergency and also some executive orders issued by the governor in accordance with those states of emergency. One affected regulatory bodies and licensing bodies, and it asked regulatory bodies to delay expiration or enforcement of expiration dates for those professional licenses that expired during the pandemic. And that was through about March 31st. And then after March 31st, there were some executive orders that even though the emergency was extended past that date, there was some flexible language which allowed regulatory bodies to consider essentially going back to normal and enforcing the expiration date of those licenses if they went ahead and provided notice to licensees and did things like that. So at the board meeting, May 10th, we talked to the board about this topic. We indicated that there were a number of other regulatory bodies that had expressed the desire to go back to normal, to maintain that we have consistent revenue coming in and things like that, and also provide some clarity to licensees to let them know what's expected from them and what timeframes. And so the board did provide the authorization for us to go ahead after May 28th to go ahead and enforce those expiration of licenses. And so we did post a message on the board's website, and we sent a message to individuals whose licenses had expired during that time frame to let them know to take action before by May 28th, the latest, to renew their license. And the board also indicated that if the state of emergency was extended, as long as there was flexible language in any executive orders, to go ahead and proceed with enforcement of license expiration dates after that May 28th date. So on May 28th, the emergency was extended, but there were no more executive orders on licensure. So we have gone back to normal, expiring those licenses and moving forward, and provided updates for information for people. So that is what's been happening on the licensure front in terms of the state of emergency. In terms of some legislative updates, the BSRB bill that was put before the 2021 legislature, that was in the form of two different bills, House Bill 2208 and also Senate Bill 238. Each bill went through the different committee process and had several amendments to those bills and were passed by the chamber, sent to the other side. And ultimately, the bill that included the final version of the BSRB items, including statutory changes, was House Bill 2208. Along the way, about 5 or 6 other bills were amended into that bill. And then some other adjustments were made in conference committee. But that bill did pass, and it was signed into law by the governor. And just recently, they had a ceremonial signing for the bill where there were some press conferences, and there were some comments made by individuals from the legislature that indicated that they believed this piece of legislation was one of the best pieces of legislation concerning mental health changes in the last 30 years. So very positive remarks about the BSRB bill. I just want to provide that feedback for you. Some of the other items that were put into the BSRB bill involved certified community behavioral health clinics, the Rural Emergency Hospital Act. There was some information about reimbursements for rural emergency hospitals and information about authorizing some out-of-state physician with telemedicine waivers to practice telemedicine in Kansas. And those were all amended into the bill along with the other changes for the BSRB licensees. When the bill did pass, we sent a message to all licensees, letting them know that what the new requirements were based on the changes in the bill. And we posted a message on the BSRB website. We received a lot of questions on those and a lot of comments, most of those positive. Just to give you a reminder in terms of things that would affect the addiction counseling profession, some of the items that were in that BSRB bill included decreasing the number of hours of post-grad supervised work experience towards a clinical license, reducing the number of hours down from 4,000 to 3,000, and also lowering the number of required direct supervision hours from 150 hours to 100 hours. And those changes were made for several professions, and they also match changes that had been made for social workers a couple of years ago by the legislature. In addition, there were some changes involving supervision and the way that supervision could be attained. Some language changes were made in the bill, and also some regulatory language that we're following up on in terms of all clinical supervision hours can be completed over televideo rather than having to be in person. And then in extenuating circumstances as defined by the board, there was language added that supervision could be telephonic or over telephone. So there were also a couple of disciplinary items that were changed, and there were some changes to the out-of-state temporary permits. But I just wanted to highlight some of those items and give you a little reminder of what was in the final version of the BSRB bill as it relates to the profession. In terms of some other items for legislative updates, there is another bill that was passed by the legislature. It is House Bill 2066. When the BSRB bill was passed, they changed the implementation date to upon publication in the Kansas Register, which is a weekly publication by the Secretary of State's office. So once we received direction from the board on a couple of the items in terms of implementation, we put our focus towards implementing those provisions. The other bill I'll talk about now, the 2066, that is a bill that has to do with several different regulatory bodies, and it includes expedited timeframes for licensure of military members, military spouses, and also individuals wishing to establish or seeking to establish residency in Kansas, and some select other individuals who've already established residence. And the implementation for that bill is upon publication of the statute book, which we anticipate happening in July of this year. That bill includes some changes to the process by which those individuals would receive a license from the BSRB. Currently in statute, it calls for essentially a substantially equivalent standard. And in this bill, it would move that from a substantially equivalent standard to a scope of practice standard. Also for those military members and military spouses, once the application has become complete, the time frame would be that the BSRB would be expected to process those licensure applications in 15 days. For the other individuals that would fit under the bill, once the file was considered complete, the time frame to process those would be 45 days. When the bill was, sorry, was there a question? When the bill was originally proposed, it was quite different, and along the process, it got amended several different times. We had submitted a fiscal note based on what we thought the impact to the agency would be. And when the final version came out, we were asked to submit a revised fiscal note in terms of the impact to the agency. And we indicated that we believed, based on the new licensing guidelines and the new timeframes, we would request to have a part-time position added going forward in fiscal year 2022 and continue afterwards to assist us with these expedited timeframes and the new responsibilities. The legislature did go ahead and approve that for fiscal year 2022. It was not put in for fiscal year 2023, but we will be requesting continuation of that when we submit our budget revised estimate in the fall. So I want to make you aware of those items in 2066. As I mentioned, the implementation date for that bill is upon publication of the statute book, which should be sometime in July. We'll also be tracking the number of individuals who apply for licensure under these provisions, and we will be providing a report the following year based on if we were meeting those timeframes, and if not, why we were not able to meet those. So that will begin here pretty soon, but we have a couple weeks to iron out the details and make sure that we have the tracking in place for those applications when they come in. A couple other bills I wanted to make you aware of. There is a multi-state compact for licensed psychologists. It's called SIPAC, and that was passed by the legislature. It initially started as House Bill 2209. The final version was put in conference committee into Senate Bill 170 and passed. The SIPAC multi-state compact implementation date is made of January. It was made January of 1st, 2022. So the board will be asked to make a couple of decisions concerning the implementation of SIPAC, but I just wanted to let you all know that that did pass, and it will be implemented as of January 1st of 2022. Additionally, there is a bill that started as House Bill 2412, and it was passed by the House but didn't go any further, and it was also a version in the Senate, Senate Bill 264, that was in a committee, and it included the Kansas Fights Addiction Grant, Kansas Fights Addiction Act, which included authorization of a Kansas Fights Addiction Grant Review Board. And that was one of the last bills that was approved by the governor this session. It actually was approved by the governor on May 21st. And what that bill, the final bill, was House Bill 2079. And what that bill would do, it was authorizing the Kansas Fights Addiction Act, and it would address the use of funds received from opioid litigation and establish limits on future opioid litigation by municipalities. And so essentially what that bill does, it establishes a couple of funds, one on the state level, one on the municipal level. And the bill would require the Attorney General to remit to the state treasurer all monies received by the state pursuant to opioid litigation in which the Attorney General is involved, that is dedicated by the terms of such litigation for the abatement and remediation of substance abuse or addiction. And as one of the items in this bill, it would establish the Kansas Fights Addiction Grant Review Board, in this committee would review requests for any of this funding in the terms of grants. And the board would receive and consider applications for grants of money from that fund and provide a list of 5 mandatory and 3 permissive factors to be considered or applied in awarding grants. So that bill has passed. One of the items that was changed when the bill was going through the process is there are a number of individuals who would sit on that. Most of them would be nominated by members of the legislature or different associations. They did amend in that one member would be appointed by the Behavioral Sciences Regulatory Board. So when the board meets in July, the board will be asked to look to see if they could appoint a member to serve on this grant review board. And then the last item under legislative items that I want to make you aware of is the Overdose Fatality Review Board. And this was proposed in 2 different bills during this last session, in House Bill 2253 and also Senate Bill 168. Those bills did not advance out of committees. However, after the legislative session had ended, we received a message from KDHE, and they indicated that they had received a federal grant for the prospect of creating an overdose fatality review board. And they were gauging interest to identify potential partners to participate in a planning meeting for this initiative. It was funded through a grant from the Center for Disease Control called Overdose Data to Action. And the funding is intended to reduce substance use disorder and overdose death in Kansas. The Overdose Fatality Review Board will review overdose cases to identify risk factors and potential points of intervention and prevention to reduce the number of overdose fatalities in the state. In addition, the board will strengthen communication and collaboration between agencies to develop comprehensive and systematic response to overdose fatalities, as well as to develop and implement prevention strategies. When I received this message, I spoke to the chair to see if we as an agency should participate in this because there weren't required number of individuals to participate. We thought it would be a good idea to have a representative present. So I have provided my information, and the first informational meeting for this group is going to be on Tuesday, July 6th. So I can continue to participate on behalf of the BSRB, but this will also be something for the board's consideration when the board meets in July to see if there should be a member of the board to do this, or if not, I'm happy to continue on as a representative for the agency for this overdose fatality review board. And then as a couple other items in terms of just overall BSRB updates, as I mentioned, the state of emergency did end. We received information from the governor about a month ago asking all agencies to have employees return back to the office starting on Monday, June 14th. So this is the first week that we've had everyone back in the office. I believe it's going very well. And it's my first opportunity to actually see everybody back in the office because I came on board in mid-November. And at the time, based on the state of emergency and the pandemic, we had most of our staff limited to about 1 or 2 days in the office. So it's been good to see kind of what going back to normal starting to look like. We were given the option to authorize telework as long as we modeled it after an approved program by the Department of Administration. So we had several conversations to see if this would be appropriate for the office. We did create a policy and we have something set up. If individuals wish to telework, we are starting this as a pilot going forward from June through December of this year. We're starting it with very few individuals who would actually be able to qualify for this because we want to make sure that it's effective and start it small. And then if it shows positive results, we can expand that. But we have gone ahead and received authorization for this, and we have an approved program we submitted. So We are trying to use telework as a way to balance any of the issues with staff returning to the office and also some of the commutes and other ways to retain staff. And then the last item in terms of the BSRB is that the fiscal year ends June 30th. And so one thing that we've been doing is making sure that we're tying up any loose ends that have to be resolved before the end of the fiscal year in terms of things like encumbrances and other items. So that's something I've been working on behind the scenes. So maybe we should stop and then see if anybody has any questions on these items.
David, do you have any sense on these boards that they want representation on, whether other agencies are going to be relying on staff or board members?
So for the Kansas Fights Addiction Grant Review Board, there are identified individuals who would be serving. It talks about an individual appointed by the governor, president of the Senate, speaker of the House.
No, I just meant for boards like BSRB. I mean, I don't know if there's others that are similar, but.
Oh, if it needs to be a member of the board or just someone appointed by the board?
Well, I don't know if it, I mean, I realize it probably doesn't say. I just wondered if there's other agencies, whether they're tending towards staff or board members.
You know, I'm not sure. I've just seen the first one or two of these that have come in. And so I can reach out, but yeah, I'm not sure.
No, it's fine. I was just curious. I realized the opioid grant review board, that was quite the laundry list of, I'll call them political appointees. And then some folks from the field as well. So, but I didn't know about the overdose board.
Yeah, and the overdose fatality review board, I'm really not sure about, because that one was not something that was passed as part of a legislative item this year. It was proposed, but I think because they received the grant funding, they were able to go ahead and move forward with it. So there weren't any specific identified individuals. They sent it to us and asked, if you believe your agency would be appropriate to assist on this, let us know. And so we responded back, but yeah, I'm not sure who would be members of this group at this point.
Thank you. Any questions for David? All right, moving to new business. So I was just wanting some thoughts from this group on some issues that the full board is, discussing. And so records from deceased practitioners. So I kind of forget the details, Leslie. We had something come up. Obviously, it's how we discuss most things. Something came up that doesn't normally come up, and somebody died, probably in private practice. Somebody calls us saying, "Where's my record?" Is that kind of what happened?
Yes, there's this one was special. They someone died. The records were in an office. The manager of the office or owner of the office wanted the records removed. The attorney told the daughter, "Don't touch them, then you're not responsible for them." So we had different people calling for different reasons. And I don't even know if it worked out, did it? Do you know?
I'm not sure about that one. I know that in general, as a last resort, the Attorney General's office did express to us they have a division that can take records temporarily. And if there are records that are a certain age, potentially those could go to something like the Historical Society. But for a certain period of time, there's not something in statute that specifically addresses it for BSRB licensees.
So that would be the question. Am I wrong? And did the psychologist say that that's part of something that they have, that they're required to do that? Or maybe
their code of ethics here.
Okay. Okay.
And
which is a lot different than a reg.
Yes.
Okay. So gang, what do you think?
I think it would be hard because you'd be in the same, even if there's a reg, right? We could technically be in the same situation, right? So, I mean, I'm sure, like my husband's an attorney, I'm sure there's something about attorney records, but if he dies, I'm not an attorney. So what? You know, the daughter, the leasee, you know, I mean, what is there to do on whoever is left?
I think we should put it under unprofessional conduct and, oh, I'm sorry, they died. I guess that doesn't really work.
Yeah. But I think absolutely there should be something that says this is what we should do. If I recall right, the facility licensing standards require that there be some kind of plan.
Right. Yeah, I'm really seeing it as a private practice issue.
Yeah.
More than anything else. It's not an easy one.
Well,
And then I think that would, to me, create all kinds of other problems. So you want some other place or entity to maintain these when you close your business, but what kinds of releases or, you know, sharing of personal data goes into making those kinds of plans?
Leslie, it seems like we were going to look into what other disciplines do, like Board of Healing Arts.
So we had, no, I didn't look there. The only thing that we've come up with are one state asks for the information when the licensee renews. And another has them send a copy of like the actual document that shows what they're going to do with them.
Like a procedure or something, or just a...
Yeah, or like a professional will or part of it.
You know, as all the baby boomers are moving closer and closer to certainly retirement and all that, that's maybe something to consider.
Yeah.
At least it would be on record. And if they don't have it, they're asked to produce it, you know, then it's like, oh, I better create one.
Right.
Oops. Or maybe it changed, right? They need to review it and attest that it's still effective. I kind of like that. Other thoughts?
Doing something like that would force private practitioners to look at that part of their ethical code, because I think all the professions have they speak to it in their ethical code about a plan. How well that's implemented or defined, I have no idea. Clearly, there would be ability to have those kind of plans. I would imagine that more and more practitioners are starting to be, utilize electronic records. So the records are not, they're not file cabinet someplace anymore. So they could potentially be accessible in different ways. But knowing each profession, what do those codes say as far as length of time you're supposed to retain, what pieces do you retain, what can be destroyed, all that kind of stuff has a little bit of variation, I think, between professions. So.
So just to clarify, like the main question being would the BSRB be the one to verify that? Is that what we're asking, or to say we need that this would be the entity that would ensure that is in place for private practitioners?
Well, I think if there was the option to go ahead and, let's say that there was a regulatory change to add it to something specifically under professional misconduct or professional conduct, and then we could add something to the licensure renewal applications. Those two things could kind of go hand in hand to provide notice about the expectation and then provide a check by either asking them to verify if they have a plan in place or asking them something more specific to say, identify, should you pass away unexpectedly, who would be the custodian of your records? So I think you probably need to do both and make sure that you have the regulation adjusted first to show the expectation. And then after that, you could add it to the application process as an option. So,
but we wouldn't be there'd be nobody to go and check on those, right? I mean, it's just an honor system and something in the file so that if we have these questions.
Yeah, there was a little discussion that potentially, you could try to add it to the audit process. As you go through and you look back to make sure that someone's met all the qualification of their hours, potentially this could be something that they also ask, we need to verify that you do have something in place. And so if it wasn't something specifically listed, you could potentially do that as an option. That has been discussed a little bit.
Yeah, I can see merit in something like that at the audit process. I know it seems like an extra step, but it does seem to be important. And like you said, it seems like this might be coming up more and more. So I would think we may be the best place for that check to occur.
So if you worked in a community mental health center, you would just attach the record retention policy?
Or just state that you're not the owner of the records.
As I think about public protection, this seems to be a pretty significant item, honestly.
Agreed.
I would agree as well. And I think it's not just older. I mean, anything can happen to anyone at any point.
Well, that's
It is
true.
the unexpected. But yeah, the likelihood for sure.
Very good point.
But it really is something that I wonder as more people, I mean, I see in our area more people going into private practice, maybe again, not having thought through that or considering that what would have to happen to ensure that clients do have access to their records so that they, for continuation of care and all sorts of different reasons. And that it does, as we talk about this, it does seem to fall under professional practice, that would be part of the professional practice. So yeah, I would agree that it would make sense to consider that as an addition.
I agree. Okay. Other thoughts? All right, good discussion. So there's been, on the next item, there has been suggestions by various groups that we add another training requirement to the ethics and diagnosis and treatment. Diversity, equity, and inclusion. I don't know how official all that title is, but was this a formal request, Leslie? I don't remember.
So this was something that was officially requested from the Licensed Psychology Advisory Committee. There were some individuals, and I believe they also had a request that came into the Social Work Advisory Committee that was very similar too. The individuals who requested it from the Licensed Psychology Advisory Committee were from KPA, and they had written the chair of the advisory committee, essentially requesting that there be 3 hours required in these topics. And then the letter that they provided to that advisory committee, they noted that Arizona, Connecticut, Maryland, Mississippi, New Jersey, New Mexico, Ohio, Rhode Island, and Texas are some of the states that require psychologists to take CEUs focused on diversity and cultural competency. And they encouraged Kansas to essentially join the list of states doing that. And then I think in the social work one, there was really just a message from the public asking the advisory committee to look into that. And I know from the national meetings that I've been attending, this has been a topic of discussion, just kind of as a broad topic for states in terms of, this as a general topic to encourage states to look at. I don't believe we received anything specific to the Addiction Counseling Advisory Committee, but those are the ones that met on it first, was probably the licensed psychology and social work.
So it seems like there was also discussion about, instead of adding, so then it would be, I'm just going to make up a number, 12 hours of required instead of 9, that something else be traded out, or do I remember that right?
Yeah, I think a lot of the professions require 6 hours of diagnosis and treatment in terms of their CE requirements every period. And there was a thought that maybe reducing this number from 6 to 3, and then instead requiring those 3 hours for diversity, equity, and inclusion. I don't think there were any requests to go ahead and just add more hours in general to the CEs. We've had some internal discussions about a couple of the different aspects, should the board want to go forward with something like this. Any changes to the requirements for continuing education would require a statutory change. So it would need something that would be put into a bill. So the earliest that something could go into effect would be if it were to be put into a bill and the legislature passed it after that point. And there would probably need to be some regulation changes too, to kind of fit with the changes in statutes. And then I think when the initial request was made, there was also the question of, could you have something that could qualify for both ethics and also something like diversity, equity, and inclusion? Could you get credit for both if the CE counted for both categories or was eligible to count for both categories? And the way that the BSRB has done things sort of as a standard is that we really haven't double counted anything in categories. We look to see, have you satisfied the ethics requirement, and we identify those 3 hours, and then we say with the remaining hours, have you satisfied the other requirements that you need to get? So if there was an interest in doing something that would allow for the double counting, that would need to be something that we would kind of look for direction on as well. So.
I vote no on the double counting.
Same.
I see the point and I see what they're attempting to do. My concern when we start doing that is, are we going to get to the point where the regulation dictates exactly all of the CEs you have to do? Because I know last year or year before, Missouri added suicide prevention. So 3 hours of that to the diagnostic for counselors. And I think they did it across all of their regulatory stuff. And I'm sure it's a reaction to the uptick in suicides, which this is a reaction to culturally the increased awareness around diversity and inclusion and that kind of stuff. So I don't have an objection. That's some thoughts about, do we get to the point where we're regulating very specific, almost all of the credits that we're asking folks to get?
Well, I can tell you that in my own shop, the creep on training appears to never end. I mean, literally, it is crazy what we are requiring people to do as part of their employment. It's just a trend that's very easy to do, I think.
Yeah. I think very easy to do. Although I think I do somewhat agree with that particular topic. Just in training students, it is something that they absolutely need continually reinforce about, particularly since the vast majority of folks in the field are those of the majority. And we tend to be very poor at understanding the inclusion and those kinds of things. So
I also wonder, just along the thinking of not encroaching on or saying, more control over what people have to learn, but also, was there a reason it was 6 hours for diagnosis? Was there something that dictated that, or said 6 hours made the most sense? I mean, to me, if we're saying this is important, and I agree, Michael, exactly what you're saying. I think there's also implications with diversity, equity, inclusion, especially in the addictions field and behavioral health overall, that have huge implications with that. So I would agree with including it. And again, maybe that replacement is that, would that seem fair? Or, still allowing people, they would still have all the other hours to make their own choice of what they would like. But I guess that was my main question. Is there a reason it was 6 hours, or that just, we came up with that number historically?
That was done before I started here.
We love those why did we pick this questions, because there's usually no great way to find the answer.
Like, probably somebody offered a course that was 6 hours, and it was a good course, and lots of people took it, and so they were like, oh, well, then That's how we need to
Six
require.
hours.
So I guess if that's the answer, then I would be very okay with them saying, like, then let's do this because it does make sense. And in our world today, this does seem to be a need for this priority for these reasons.
Well, and honestly, I don't even think there are places that are, or like CEUs that I've seen are like 5 hours for DSM. Like the numbers aren't always the 6, and I get it, but like I personally, for me, because I'm dually licensed, I want to be able to have the flexibility to choose whatever CEU that I want to take that is going to help build or expand my knowledge in treating clients, because our clients are going to be different. And I think what was mentioned before, the majority of our population happens to fall in that DEI. And then looking at our students or those new clinicians, and I say that in quotes, those babies, they're kind of like that next generation that really does need to understand, everything that's kind of transpired within the DEI.
So would you be in favor of requiring that in lieu of 3 hours on the dike? Is that what you're saying?
I would. I mean, I'll be honest, I've done the 6 hours and it's kind of frankly boring. It's the same thing that you do every single time. It's not really too terribly different. I would prefer the DEI because I really think it's very pertinent to what we're talking about with our clientele. I can do the 3 hours, very simple, but I think if we added that DEI, I think it would make people better clinicians because you're aware of what's going on. And I think if I were putting myself in my client's shoes, I would like to be able to be referred or be around a clinician that understands diversity and inclusion and equity. And especially working in the middle school, that's huge. Like we have a lot of kids that are struggling. And in addictions, I've worked with teens. Like there's a lot of people that are struggling and people just don't understand how to deal with diverse populations. So I would be 1,000% in favor of making that a 3-hour course or 3-hour training or CEU on top of the DSM.
And DSM would be 3 and ethics ethics would be 3 and DEI would be 3. Is that what you're saying?
Yeah, I mean, honestly, people will always offer, if you tell them what people need to do, they will find ways to make it 3 hours.
Absolutely. The other piece would be for the LACs who only have the ethics requirement versus having the diagnostic component within that. That would require another reg change for them.
Yeah.
And honestly, I think if we have to, they would probably be even more important in some ways to target with this particular topic matter.
I think this is a good discussion. I think you all are the experts on. I'm still learning what all the CEs are even required and all of that. But I agree that this topic, to me, seemed as if it could be at the base of what a lot of the other issues spring from. So it makes a lot of sense for me that practitioners would have that experience and that knowledge, and I support that.
Okay.
I think
Kind of change something that would be a statutory change.
Yes.
And is there any feeling about the political support for this?
I think it would be supported, especially if we switched it out and didn't require something additional.
Okay.
Do you worry it would not be?
Oh, I don't know. You see things about lots of political fights and opposition to different types of education, particularly around these issues. And I don't know the current legislative makeup enough to know if that's where Kansas is or not. Seems like in other places for sure it would face some steep challenges.
Well, anything that's more prescriptive, I think, will get a stiff challenge. But this seems like a compromise that it all depends on our stakeholders too, right? I mean, how much do they come out in opposition to this? So, yeah. So we'll see.
I also think how it's framed is getting back to, again, the protection of clients, that what this is a benefit to clients, that there's been so much movement and learning, even in the last 5 years, I think, in this area, that we, again, for the field to have that be a priority, because of the implications. I just keep going, all the historical, the current strife, the what is happening with transitioning youth, all of these things, and how that leads into these individuals that we're going to have presenting for services. I think there could be, again, a framing of that too, of why that's, why that is so important at this point. Even though, again, it's replacing, as Michael mentioned, for the LMACs or LCACs, but it would be an additional for LACs if it was added to theirs.
Right.
Well, and for me as an African American, I will tell you it is a underrated area. I can say personally that people don't follow that at all.
Yep.
And I think, realistically, when we think about the populations we service, I think of like social workers. Social workers, they are trained to work with diverse groups. And it would be almost kind of a disservice to not understand or be trained, but yet you're working with this population. It's kind of almost a slap in the face. So I really do think, as Christina's mentioned, I think in the wording, it could be something that many people, especially given with all the movement that's been happening across the country, I think that people would be in favor of being able to say, hey, this is something that we're looking at. I think even in schools, they're starting to, talk about, DEI. They have DEI in higher education. So they're doing a lot more, I think, to really promote it. But I think for clinicians, it's just continued education because everything always changes and evolves.
Yep. Okay. Good talk. All right, next one is a little meatier, just in terms of the things that we sent you to review, the in residence. So this raises its head quite a bit. And as you can imagine, with COVID and all of the tele everything that we're considering and doing now, this just fits right in with it. So you see the email responses we got back from different educational institutions. I did kind of a tally, and it looked like the majority are in favor of at least some relaxing. And then there was some emphatic no's. Don't relax it at all. So there you go. The joys of being on the BSRB. What do you guys think?
I think it was really my view, and when I kind of read through that, was it was pretty specific, the ones that were adamantly against, and it was the types of training that they were more specific on. I know, the one tended to focus on those that are the psychology training, then do the testing and trying to, I can't imagine trying to learn how to administer a WISC or a WACE or an intelligence test virtually. I think that would be extremely challenging to accomplish, just because the scripted nature of those kind of things. So I get that argument from that standpoint, absolutely. And I do not know. I think it was the folks from KU just said, well, what does APA standards tell us we have to do? That's what we will do.
Right.
And I don't know what APA's view of that is as far as the credentialing or accreditation for them with that piece. But that type of training, my guess is the schools will probably require the residency regardless of how the board does it. The other ones that were more in favor of it tend to service more rural populations. So it's, I think some relaxing probably wouldn't hurt. I don't know that we would want to eliminate, because then that might, I don't know how many of the fully online program application students do you guys get, and do those programs meet muster, or would that increase those that are coming that are maybe less robust from the fully online, the fully online schools, that kind of stuff. I mean, the academic institutions we're talking about here are all brick and mortar schools, but there are plenty of those other national ones that are not. I don't know if that would increase a burden on BSRB to try to weed through that. So I don't know how many you get from the for-profit schools that may not have residency requirements at all.
We are getting more now than we used to. A lot of military, and by a lot, I don't mean like hundreds, just it's increasing. Military coming, like for counselors, professional counselors, they have KCREP accreditation, and if they're KCREP accredited, they can be all online. If they are not, then they have to meet, theirs is half of that 60 hours, so they have to have 30 semester credit hours in residence. But it is increasing.
Do you think, like, is that, I'm just looking at that military piece, especially with the bill, right, that's just passed about allowance. And I'm wondering if that's a way, if that's really true, that a lot of these are military, to go ahead and allow those, because there's kind of cover. We didn't really get into that bill that much, but
it's for more for reciprocity than standard applications. And I showed Dave a statute that talks about us accepting online education for military, but it only includes the military service member, not the spouse.
okay.
So one of the things, and I was just reading this in some of the responses, to me, this is and just to be very transparent, I'm very supportive of online and synchronous type programming and Zoom, televideo and face-to-face considered through televideo and some of the changes we made already. I just wonder if it's about preference versus the research, and when we see actual satisfaction and outcomes and quality of services provided. If we look at that, that's what I think is important, not people's preferences. And so that dictating how we say students have to learn, because that's a preference in some ways, versus the actual research data of what people are learning. Do they learn the competencies? That's what we're really hoping. Do they have the quality of services? And so if somebody's accredited and they're providing the education through whatever modality that is that as important as the quality of what the student is learning, the outcomes? If they've met the competencies, they've graduated, I guess I look at those things as weighing heavier than someone's, it's just my preference to teach it in person. And so, even one had said they hope that by allowing more online, that might reduce their
demand for their in-person.
Exactly. And I think that's somewhat self-serving, and also not appropriate to base restrictions or not on, again, because if people are demanding this and they're saying this is the way I prefer to learn, because if we're giving people a choice, they can be in person, they can be online, but if their choice is that. And I think it also lends to some of the things we talked about before it's really about availability, resources. Not everybody can quit their job and move to a town and be in person. I think it's really exclusive to say you can't learn this way because that's the only way that fits in your life. And so I think if we just had the discussion about DEI, and I think it needs to also filter into what we're doing in the state in allowing some of these things, because for some people, and it's not just rural, you could live in a very urban area, and again, because of the realities of life and resources and money and all those things, this is the best option. And I think we've always said that this is the best way because in person was the only way, but it's not anymore. And so I think we are learning, and I hope over this last year, we're going to have more research, more opportunity, because we have a bigger in group to say, people are just, you know, and I can speak like supervision. When we look at research of people that receive supervision through synchronous televideo, they're just as satisfied. They have just as, you know, they're providing really good services. So if we look at the data and the research, I guess I hope that weighs in there too. Obviously, you know, there's lots of different views, and there's, you know, good to take that into account as well. But I just wonder what we could look at on that front to really base our judgment or, you know, recommendations going forward.
Say, I don't know, Kendall, if you're maybe aware of some of the research around some of that. The little bit I've seen, you know, tended to be some of the more traditional online programs, the for-profit schools that have struggled with other issues. Now that the more traditional brick and mortar have moved more to this, and I know Fort Hays is one that, you know, is powerfully present online with their programs and has done so for quite a while. So maybe there is more literature out there than I'm aware of.
There's some research out there. I haven't looked for some time. I'm not going to be able to tell you what, but they're not seeing a difference in the learning and carrying out services and that kind of thing. In fact, I'll see if I can't find some of that and share that. You know, something that you brought up, Michael, was around you know, administering psychological testing and things like that. I think lowering the in residence or relaxing that, but that's not saying somebody has to do that. It's allowing for that, and how you know, I think if those are things that couldn't and shouldn't be done virtually, then I would think ethically that would then be up to the individual to figure out how not to do that ethically, so it is done properly. Perhaps this isn't forcing anyone to do something.
Right, and I think that's probably the biggest thing. It's allowing for it to occur. Now each profession might have a little bit different take on it.
I agree. You know, like you said with the APA bringing that up, if you know, if it doesn't allow that, then I could see certainly a psychology. And if I remember, psychology was primarily where the no's were coming from, if I'm remembering correctly from reading that.
That was my kind of recall too, and it's been a couple of days since I read those. Though was the ones that the psychology programs tended to be the ones that were more focused on that.
Fort Hays psychology, of course, took a different perspective because of their large online presence. But I know as one with it, what education counselor, something on that order was one. So yeah, so even all the psychology didn't agree, but I think what I remember reading was primarily from there. And I think going back to what Christina was talking about too was the programs they're fully accredited. For instance, through Council on Social Work Education or whatever accreditation body. If they're okay with that, I don't know why the state would continue to be a holdout on relaxing some of this.
The other thing
go ahead.
Another thing that just sprung to my mind, Kendall, as you were talking, I was thinking about the services that we're allowing, the services that are happening this way. This meeting is happening this way. You know, that the idea or the point there that relationships can't be built, that we, you know, quality services in education, how is it different that we'll allow it for treatment? Mm-hmm. But we won't let it for educating those people that are going to be providing that treatment over that modality, you know, in all likelihood. So, I mean, I think, again, that consistency there in our thinking.
And I really think that's maybe there's probably more positives in this, but at least one positive with the COVID was figuring out that, you know what, things can be carried out technologically because of all the advances in technology. There's so many things out there that, you know, even like Go React and all these various programs where, you know, students can record themselves interacting with a client and that kind of thing, whether it's a simulation or real client, but probably simulation where they're demonstrating skills, demonstrating engagement and intervention and planning and all this business and getting scored on that. Plus, you know, they're also being touched by the field instructors and other individuals at the agencies when they're doing their internships. And those are folks that really kind of need to be gatekeepers anyway, even if you're face to face. And then residents on 100% of the coursework, the practicum is, and your professors or instructors are not face to face with that student in the practicum. You're still relying on the internship and those field instructors being able to provide feedback and even if it's, you know, some of that's done virtually.
Yeah, I guess it kind of comes back to, do we want the board to be dictating this piece, or do we push that off to the accrediting bodies for the different subfields to kind of make the decisions about that piece? Like APA may make that decision about the PhD level psychologist. They may say, no, you have to have in residency, which I wouldn't doubt that they're going to have that component for them.
Right.
But NASAC may say for the associate level substance abuse, you're good, go. You know, online's fine, but at the doctoral level, they may have different requirements. And I don't remember if NASAC speaks to that. I'm still working on mine. So,
is this the in residence? That's still that piece back from 2010 with. So yeah, and it was, I think the biggest pushback was psychology at that time. If I remember correctly, different representatives that really pushed for this. And in fact, you know, brick and mortar only was at that time, which has been 11 years ago, but
it hasn't changed.
Hasn't changed. But that was their stance at that time. They didn't even want to hear about not having in residence. In fact, I think if I remember right, we wrote the standards a little creatively.
Yours does, yes. Yours are the most creative.
For the addictions, for that reason, because they were, the way they were wanting it, you know, if you were, I don't remember exactly, but would have been incredibly difficult for folks in the rural, you know, where you've got people placed all over the place and not in one community for the most part, to meet some of the standards of how it was being defined at that time of in residence and what that actually meant, and might have even eliminated some things from even participating, but I don't remember all that.
Weren't there for addiction counseling, wasn't a lot of the programs already online because of how it started in the state?
Yeah.
And
Yep.
Right. Yeah.
Well, you just had a select few, right? So it was unrealistic that people were going to drive to Allen County and get their
Right.
addictions courses.
Right. So
the part of the problem though is the professional accreditation, and we don't use NASAC, and maybe we should look at that to use that if that's what's the standard now. But for counselors and APA and social work, if the program is professionally accredited, they can be online. If they are not professionally accredited, only regionally accredited, then they cannot be online.
Right.
And of course, people are going away from professionally accredited programs because people are working, they're not, you know, able to go in person, or for whatever reason. I see a very large increase in programs that are not professionally accredited, not for social work, but for the other professions.
I'm assuming that's probably family therapy and counseling and psychology and social work seem to be, if I advise a student and you're going to a psychology program and it's not accredited by the APA, I'm like, don't go, don't bother. It's kind of like saying going to a social work program that's not accredited, don't bother. You're wasting your time and your money.
Right.
I don't have a feel for how many of the addiction programs across the country are getting the NASAC. I don't know if it's solidified as the full standard or not. I think it's the only one that's out there, so I'm assuming it would become that. Kendall, did Fort Hays get that one?
No, I don't think so.
Okay.
But I'm not positive. I guess I probably need to look into that. I think the majority of students are going through on the sociology side.
Right.
So, and I'm not sure what. Yeah, I'm not positive.
Okay.
Is there other thoughts? I mean, it sounds like, and myself, maybe that we have spoken of, said, that this very much looking at the online being something that could be equitable to in-person, but are there points we're missing, or is there another? I guess I would just love to hear another side if there's something I'm not thinking about.
Well, one of the comments that I was going to make, it's not directly answering that question, but regulations are generally a minimum standard. I mean, you hopefully set regulations that will result, like there's a dotted line to quality care or to protecting the public, but they're supposed to be minimum, right? Not maximum, not best practice, not the best it could ever be ever. And, an accreditation, is that icing on the cake. If you want to be accredited, right, then you go that extra step. You go beyond the minimums. Facilities are accredited. The idea is you've demonstrated something above and beyond. But there's been a general philosophy, I think, in the board that the regulations should not be minimum, that they should be equivalent to, by gosh, the most competent ever. And I think it's a hard philosophy to let go of, because for me, the tension is access. Mm-hmm. And this is, let's be real. A lot of regulations in these disciplines were created to keep people out, to keep a minority number of professionals, right? And you can, I'm just going to be real. You can dress it up as because we're so good, but as we determined over and over again, as we looked beyond, well, why was it this? Well, why was it that? Because someone decided it was, or because it was already what they were doing, or because it was in their best interest. And I'm not saying people didn't have good intentions. I'm just saying you have to kind of call it what it is when we get to this point of the crisis that we're in with behavioral health. And we have to say, is it time to look at what our role truly is in the interest of access? Because we don't have data that says these online schools are crap and the brick and mortar schools that are accredited are great. We don't know that, do we? Am I missing something? That the professionals we're churning out are qualitatively different in some measurable way.
I've not seen any literature that points to that. Obviously, increased accreditation. It's kind of like when we decided to go from the come on in, we'll train you and make you a counselor. Now you have to have a degree. It's the same issue. Does it actually improve? I don't know. The odds, I think, are in favor that it may, at least some, or weed out some that might have made it through and caused some damage along the way. But yeah, I think so. From educator standpoint, I'm generally okay with maybe lessening that component. From clinician standpoint, I have my concerns, my worries, but I can tell you from teaching virtually, if you as the instructor put the effort into it to make the course more interactive and active and all those kind of things, I think the students get quite a bit, if not as much out of it, and sometimes maybe even more if they're dedicated to the course. Now, if you don't adopt the technology and you kind of fumble along, absolutely it's less than an on-ground class. But I don't think that's the board's job to even try to push that one way or another. That's the institutions themselves have to make those choices about how well their faculty do those kind of things. I'm guessing, Kendall, that's kind of your experience. On grounds, you prefer it in some ways, but online, if you do the footwork ahead of time, and the synchronous component absolutely improves it. The thought of completely asynchronous does bother me a bit.
Michael. Go ahead. Sorry.
Oh, I was just going to say, I mean, you could say the same for in person. There's what guarantee is there that someone hasn't fumbled about or not been prepared?
Absolutely.
I guess where I get into it's about the quality, not the modality. And so, again, I think I would agree completely with that. Institutions, they're going through vigorous processes to be accredited to have these standards, as far as protecting the public, ensuring good quality services are happening for clients. I guess I'm waiting to hear the good support for why online or this, again, this virtual is not adequate to do that. I don't.
So Leslie, let's just go to hypothetical. We say no more in residency, which means then these non-accredited schools will be looking at them more in a different way, right? That won't be an automatic, you're rejected type of thing. So what do you see otherwise? Is there other components? Is there other pieces of evidence we need to consider that would, is that a good reason? I mean, we'll call it arbitrary. Is that a good arbitrary reason to keep these schools out, or is there other reasons?
I asked the question because I don't know. I know that when the regulations were written, the online schools were not very great, very good. There were a lot of problems, for instance, here you can have life experience for some of your coursework, things like that. But now I think, obviously, since some of them hold professional accreditation for programs, they must be better. What I don't know is the way our regulations are written, how you can evaluate that for an online program. There's got to be things that would show that it's a quality education, but I don't know what those would be.
So would it be something where if it's accredited, again, we would make kind of there's a level of competencies, things that have to be there. If they're not accredited, would that be then to evaluate, to make sure each course is taken, the syllabus is to make sure that the courses fulfill the individual, or is that too labor intensive? Would that be something that could
actually something that we're doing now for courses that don't hold professional accreditation, only the post-secondary, I forgot the whole title. They have to go before, and we're currently working on getting specialists to review those for the different professions that would look, and there's a whole questionnaire from the regulation. It just goes down, every single thing that's in the reg is in the questionnaire, and then they have to send that back with supporting documentation and all the syllabi to show that the courses are covered. So it's intensive, but it's not.
What percentage of those cases we rejected solely because of the in-residence?
There's some. I have for counselors, the two things are in residence and not having a person with a doctorate degree in counseling as the program chair. Those are the two big things.
Hey, Leslie, I had a question. So I know we're talking about, in resident or like kind of looking at like our KUs versus our Waldens, for example, that's like an online school or a Capella or something like that. So when we went through COVID, where everything was shut down, like, did they put a pause on the residency requirements? Because I know with COVID, there were a lot of people that had to go back home and they could not physically make it back to their institution. And so online school just became kind of the norm for some people. Or those students that maybe get rejected or don't get into that school, but are able to get into an online school. Doesn't mean that it's anything against the institution. But I do know that, I think like everybody has kind of said, I would love to see the data that says a KU or an Emporia State is better equipped to present psychologists than Walden University or Capella.
Right. We don't have any data for that yet. We haven't really done that yet. I'm sure it's going to be soon, but they haven't really, the board hasn't even gotten into that. And I don't know how that will be handled. But for KU, they didn't have, they had a whole year, just like everyone else, the students didn't come to school, but it doesn't matter because they hold professional accreditation for the programs that get licensed.
So the short answer is we had no allowance under COVID to say, oh, that reg doesn't matter right now. The only thing was expiration dates.
Exactly.
That was it. I mean, we wanted to. We petitioned the governor's office. We did a lot of things. None of it worked. And at the end of the day, we have to follow the law. So there's that answer. There was nothing that can be done differently about that.
Right. So
go ahead, Michael.
The one question that I do have, the accreditation component, all of the licenses require regional accreditation, right, of the institution?
Yes.
Okay, so that by itself eliminates many of the schools that I think we think about when we go, ooh, what's that like?
Yeah.
The regional accreditors are a little bit more robust than the fully online accreditation component. So I think that helps eliminate some of that. And then if you go to the professional, that narrows it a little bit more. So I don't know that the board needs to get into that, if that makes sense, to, worrying too much about that, let that system do its thing. And like you said, Deb, what's the bare minimum? And I think loosening, I don't see a huge downside to it based upon experience with the online component, that it can be sufficient, if not as good.
So and you said, Kendall and Leslie, addiction counseling was already fairly loose? Sorry, I didn't go in and look at that before this meeting.
Yeah. So your regulation allows your in-residence courses to be both of the practicum, I don't know, or two other courses, treatment maybe, and I'm not sure, I'd have to look, but the fact that you can, and your definition of in residence is also different than other professions, the core faculty. Your definition allows the people on site at the practicum. So yours is just more open because.
I think kind of count, it's been so many years since I really looked at it closely, but the field instructors are counted as a core faculty, right?
Yeah.
That are at the organization.
And the other professions don't do that.
That was a way to get around that.
So
maybe the way the addiction one is worded is fine for an online program. It works.
Mm-hmm. Yeah, because it works for, oh my goodness, my mind went blank. It works for Washburn. Right. And Washburn Yeah.
Okay. So maybe next time we meet, we'll get that in front of you and we'll just see if this committee recommends any changes to the language you already have. And maybe we don't need any.
Deb, this is
Yeah.
going to be discussed in September. So
Right.
you'll meet again before that, right?
Well, on our quarterly schedule, we
Oh,
would
you've done the
meet,
3.
would meet right before it.
Okay.
Right before, yeah. But I was going to talk about that date when we get done here. So, all right. Awesome. Allowing individuals who qualify for LMAC but can't pass the test to be LACs. So as we all know, we had 2 levels of licensure when it first passed. And so we had a lot of master's level folks who would only qualify for LAC because they didn't quite meet the threshold for LCAC. And then when we created the new level LMAC, I kind of assumed, dumbly it turns out, that if a person couldn't, for example, pass the test, maybe they had a master's in social work and they couldn't pass that test, that they could then take the test for the lower level and be an LAC like we used to have. And it turns out that we created language that actually prohibits that. There's no allowance to take the lower test and become an LAC. So the question to the committee, is that something we should fix?
And where that's become a problem is for people who are licensed. Because you can do it if you can meet all the requirements. You could technically test. But for people who hold an LMSW, the statutes don't allow them to apply for an LAC.
So we allow it if you don't, that seems discriminatory.
Well, they could, if the LMSW could meet all of the requirements, like all the coursework and the practicum and all of that, then they could apply for an LMAC or an LAC and qualify that way to test. But if you're licensed and you don't meet the requirements, then no, you can't.
So to paraphrase, if I'm an LMSW and I'm trying to get in lieu of just from the test, then I can't do it that way. I either pass the test for the higher level license or I'm out. I can't become an addiction counselor.
Right.
Right. I think that's terribly unfair. And I'm just dealing with workforce shortages, even here in Johnson County. We consistently hire people under a temporary LMAC, and occasionally they struggle to pass the test. And so I dumbly said, hey, we'll just take the lower level test. I don't need you to be, an LMAC for your job. I just need you to have the addiction counseling license. And then I found out it was wrong. Fortunately, It hasn't really been an issue. They all passed, but.
And you also don't have a intermediate exam. You have the MAC that you have to pass is the same for the clinical, so you don't have to take it again. But I would imagine that's part of the reason it's harder to pass.
So there's no exam for the LAC?
No, there is.
It's just a
lower level, yeah.
So the only thing I think of is that, and I'm trying to remember back when that all came about, 2012, or that we had talked about, and I remember Deb being in the association meetings and we talked about this, that like from the social work perspective, I would love to say that if you graduate with your LMSW, you have all of this knowledge around addictions. And I don't know that I could strongly back that up. I think that had been there again to say there's this proficiency, that you take this test to show proficiency.
Right. But we used to be able, before we created the second level, an LMSW could only take the lower level test.
Right.
We granted LACs to people all the time.
So that's right. And just to finish that, I'm agreeing with you that as long as they're taking a test to show proficiency, if they show that proficiency at the LAC level, I guess I would think that that would be okay. I mean, that again, that would be, they're still showing that proficiency. We're
Right.
saying you have to take this exam. If there wasn't an exam at that point, I'd say, yeah, they probably need to take
I
something.
think social
I
work already-
Yeah,
I think
but
social work that way, if you can't pass LMSW, you can take the LBSW, right?
Only if you have a BSW.
Well, okay,
Yeah.
but yeah, so for instance, I got a BSW, went straight on to get my MSW, never took the BSW, but I could have taken it if I couldn't have passed the MSW, correct?
Yeah,
Yeah.
we have people do that.
So I don't see I'm agreeing with you, Deb. I don't see a reason why we wouldn't allow that. They still have that, I think what Christina said, they still have that exam, they would still have to pass.
I have one memory about when this happened, because I was kind of like, oh, okay. I said, so the way it's written, you can only take this level. And I was talking about clinical. So what if they don't want a clinical license? A, it's more expensive. B, it just may not fit into their plans. And they said, well, why would anyone want a lower level? Well, this would be a good example.
Because it would save their job. I mean, I was looking at having to transfer someone to another division.
Right.
Some people just aren't good test takers. I mean, that's,
Right.
Talk about diversity. I mean, we have kind of an interesting, antiquated way of determining competency, but that's another story. It's efficient, we'll say that.
so what would be the way? Oh, go ahead, Mike.
It makes sense to me to allow somebody who has a master's, therefore LMAC prepped,
Eligible.
that's going, they're eligible because of other licensure, to be able to get the LAC. What does that do once they're an LAC? Does that then channel them into the supervision plan for LMAC, LCAC kind of process? So it basically puts them on the LAC track as if they don't have that other license, right?
Yes, technically. Yes. I don't know.
Could they
if you
then,
want
yeah,
that.
right. Could they then come back, 2 years later, they have the LAC and say, no, I want to reapply for the LMAC and not go through the supervision to get to it because
Well,
of the other license?
They could apply for the LMAC, yeah, forever.
Okay.
They
The
don't need
problem is
supervision.
they just have to practice in the treatment facility, the licensed facility. But yes, an LAC that meets the requirements for an LMAC could apply at any time.
Okay. Yeah, no, I don't see any. I was just kind of thinking logistics. Was there something that was going to cause a glitch for processing for you guys if we were to open that up? But yeah, let them take the lower test and get the LAC, and the employers would be happy.
Please let them in.
Right. I think because of the test, technically an LAC should not be able to start a training plan until they have an LMAC. Because that's different.
Right.
Puts them in line with everyone else. Yeah, that would be the only thing that
Yep.
we would have to fix in a array.
Yeah, I don't have an issue with that at all. It doesn't seem to be an issue. It's some people are not good test takers, as you said, and that's not a measure of their ability to do the work. So
Well, again, we're already talking about people who've already passed a high level of competency in their training and test taking.
Actually, way back when it was just certification that, CADC 1 and 2 and stuff. I found that, I think the second exam I took was the LMAC, but I found it much easier than the first one, quite frankly.
Really? That's
Yeah.
interesting.
But
All right, thank you.
Yeah,
So
we-
can we put that on the agenda for the board meeting at some point?
Yeah.
That's probably,
And that part would require a statute change.
well, it looks like we're gonna have a few next year.
Yeah.
I know you're excited.
yeah.
I
Hopefully we
think
can stay out of controversy though. All right, well, that's the end of our normal agenda. I just wanted to let everyone know that, of course, I am the current chair of the BSRB and I am stepping down. So we will be having elections at the next board meeting. Leslie Seawester is the current vice chair. And then you know, we'll see what happens, but I know she's willing to serve. Anything else for today?
So Deb, you said you were going to have a little discussion about the date of your next meeting?
Yes, thank you. So by our current schedule, it looks to be September 17th.
Yes, that's what I have down. And what I recall from the last board meeting, so the board offsite meeting, one is scheduled for Olathe, been referred to sometimes as the board retreat. That one is scheduled for the last Monday of September, September 27th. And I believe last board meeting there was, so the normal date for the board meeting in September would be September 13th. And I think there was some discussion that you could potentially have that as a regular board meeting to allow you to focus on other material for. So potentially, if both of those occur, there would be a board meeting on September 13th and then the offsite meeting on September 27th.
Right. Doesn't feel like we need to, do you feel like we need to have a definite answer about in residence by the 13th, or is the offsite soon enough?
That's supposed to be discussed offsite, right?
Yeah, I think the previous board meeting, that was one of the topics that was going to be discussed by the board.
That's what I thought. All right, so we can just proceed with the 17th. Does that work for everyone? Do you still like the 11 to 1?
Yep, that works.
It still works for me next semester, yes.
That's fine.
I don't know if this matters at all, but that is the ACMH
Oh, it
annual
is.
conference.
It does matter.
Yeah, that falls the 15th to the 17th.
All right. What do you guys think about the 10th?
That's my retreat for school for KU.
Yeah,
I mean, we
think
can still. Oh,
sorry. The Marriage and Family Therapy Advisory Committee is also meeting that day.
Oh, okay. What about the 24th?
Fine.
24th work?
I don't see any issues on the
Okay. We'll meet on the 24th then. 11 to 1. Okay. Anything else for the good of the cause, or motion to adjourn?
I'll make the motion to adjourn.
I think that's appropriate, Kendall. All right,
I'll
Kendall, you
second
take
it.
care.
Will do. Keep up the good work.
And Deb, was there a second for the motion?
Christina.
Great.
All right. All in favor, say aye.
Hi.
Aye.
Aye. All right, guys. We'll see you later.
Take care.
Thanks.
Bye-bye.
Shit. Ashley was talking about minutes and how people